Please be seated. His Excellency Dr. Muhammad Irfaan Ali, President of the Cooperative Republic of Guyana, the Honorable Dr. Frank Anthony, Minister of Health, the Honorable Robeson Ben, Minister of Home Affairs, the Honorable Colin Crowell, Minister of Housing and Water, members of the Diplomatic Corps, Permanent Secretary of the Ministry of Health, Mr. Malcolm Watkins, Chief Medical Officer, Dr. Narain Singh, Program Directors of the Ministry of Health, Regional Health Officers, members of the Armed Forces, members of the private sector, members of non-governmental organizations, and very importantly, our children, parents, our partners and men on mission, the members of the media, good morning to you all. I am humble and privileged to be tasked with guiding this esteemed audience through a simple but very significant program today. It is my hope that you are well and you're in good spirit this morning, because we are embarking on a very important initiative today that speaks to our overall well-being. If for some reason you don't feel too well during the course of this session, we have arranged a medical team on the lower flat of the building to the northern side of the building to assist you with any emergency you may have. Having a healthcare system that does the most it can to improve the health of our people is an important and critical component of our developmental landscape as a nation. A system that protects citizens from financial ruin while assisting in diagnostics, treatment, rehabilitation, and providing the support for palliative care, all of which conform to our values as a society. Getting there will always require well thought out and calculated initiatives that speak to the very core of disease prevention. Appropriate and relevant investment in primary health care, specifically in relation to health education, health promotion, and the introduction of early screening and diagnosis, is one such relevant and appropriate initiative. The government of Guyana is making this relevant and necessary investment strategically in partnership with the private sector of Guyana. This partnership is very pivotal and strategic for the success of this initiative, as well as to secure maximum benefits to our population as a whole. Our population also has the responsibility of taking ownership for its health by utilizing this initial subsidy to facilitate laboratory screening. It has been said, a healthy nation is a wealthy nation. This phrase highlights the importance of prioritizing public health as a foundation for economic prosperity. Hence, this additional screening initiative that is being launched today is being placed alongside a wide menu of services that are already available in the public health system, free of cost. With that brief comment, I take the opportunity on behalf of His Excellency Dr. Mohamed Irfaan Ali, the President of the Cooperative Republic of Guyana, and the Honorable Dr. Frank Anthony, Minister of Health, to welcome you to the Government of Guyana Universal Healthcare Voucher Program launch and distribution exercise. At this time, ladies and gentlemen, I would like us to make way for an overview of the Universal Voucher Program. And to help us with that, please welcome our Director of Non-Communicable Diseases and Mental Health Program at the Ministry of Health, Dr. Lakshmi Lal. Please welcome her.
Thank you, Mr. Gravaya. Allow me to stand on the protocol that was established. His Excellency Dr. Mohamed Irfaan Ali, President of the Cooperative Republic of Guyana, Honorable Ministers of Government, members of the Diplomatic Corps, members of the Ministry of Health, and to all our invitees, a pleasant good morning to you all. It is with great pride and commitment to the health of our nation that I stand before you today to speak about a groundbreaking initiative, the Universal Healthcare Voucher Program, an initiative that will transform the way we approach healthcare in Guyana. Our government, under the visionary leadership of His Excellency, Dr. Mohamed Irfaan Ali, is making this voucher program possible. Our President has made it clear, healthcare must be accessible, proactive, and preventative. No longer should our people wait until illness takes hold before seeking help. Today, we embrace a future where early screening and timely intervention can save Guyanese lives. With a $5 billion Guyanese dollars investment, this program will benefit over 500,000 citizens, both children and adults, providing them with a $10,000 healthcare voucher to access critical medical testing, tests that can detect diseases like diabetes, anemia, coronary heart disease risk, kidney disease, diseases of the thyroid gland, increased risk of prostate cancer, hyperlipidemias, and uncontrolled cholesterol levels before they become life-threatening. This initiative is more than just a policy. It is a lifeline. By partnering with 36 healthcare facilities, we can ensure that this program can spread across all 10 regions at a faster rate. We are also pleased to announce that we will continue to partner with a total of 31 eye care facilities and 8 HPV screening providers to continue with programs that we started last year. We are ensuring that every citizen, regardless of where they are, has access to high-quality medical screening and care. Citizens will receive their vouchers at health centers, hospitals, and outreach programs. These vouchers can be used at private clinics, labs, and hospitals across the country. Once tested, results will be sent to physicians at our hospitals and health centers, who will guide patients on the next step of care. Testing results can also be picked up directly from providers as well. But we're not stopping there. Special efforts are being made to reach remote communities and hinterland regions because no one should be left behind. School health screenings will be conducted with parental permission, ensuring that our children are monitored for early signs of illness. Community outreach teams will bring healthcare services directly to our people in the remotest of areas in this country. Through this program, we will detect diseases earlier, leading to better treatment outcomes, reduced healthcare costs by preventing complications, improve life expectancy, allowing our people to live longer, healthier lives, and we will also be able to gather critical health data that can improve future health policies. For this program to succeed, we will need your help. Each and every one of us here has a role to play. For citizens, I encourage you to take advantage of this opportunity. Get tested, stay informed, prioritize your health. To our healthcare providers, participate in this program fully and ensure that you provide quality diagnostic services. For our community leaders and NGOs, you may have the biggest task to spread awareness, encourage participation, and support outreach efforts. And to our government agencies, help us to ensure smooth implementation, coordination, and monitoring of this historic program. This initiative represents a bold step forward, a commitment to building a healthier, stronger, and more resilient Guyana. By working together, we can reduce the burden of disease, improve access to quality health care, and create a future where every Guyanese citizen has the opportunity to live a full and healthy life. Let us seize this moment. Let us take action. Together, we can build a healthier Guyana. Thank you.
Thank you very much, Dr. Lal, for that very comprehensive overview. We want to invite at this time to do a skit on the voucher use to help us further understand how we can go about utilizing this voucher initiative to better our health. Please welcome the live performance by Nothing to Laugh About.
Okay, yes, Okay, all right. So you mean to tell me it's all of that? Oh, that is nice, man, that is nice. All right, yes, good. All right. I'll make sure that he check, all right, good. Thank you a lot, right? William, come here, son, William. Yes, son. I just came off the phone with your Aunt Maria, and she's telling me that the Ministry of Health have some new voucher programs that will allow me to go and do my blood tests at them big hospitals and labs. You hear anything about that? Well, I know you're up on social media a lot, son. But check the Ministry of Health Facebook and TikTok page and see if they got anything advertising.
Look, Dad, it's true. They even got one for me too. For children, look.
Okay, all right. Let me see. Let me check the phone.
Marcus! Oh, I was trying to get your attention, Marcus.
Oh, jeez, man.
Did I do it? Did I get your attention? Okay, Marcus, I just went to the health center and I collected these vouchers for us. It's a $10,000 voucher, one for me, one for you, one for William, and one for Matthew. The girl at the health center said we could use it to check our kidneys and blood count. Oh, and look here, Marcus. It says that we can also check our diabetes. Marcus, I find you should do that because you be peeing a lot. Like you're going to the washroom a lot, Marcus. You really need to check that diabetes thing out.
You got to announce my business to the whole neighborhood, man.
Oh, Marcus, there's a lot of tests that you can do. Look here. It says you could do a thyroid function test. And a lot more.
Noreen. You see, you play, you know everything, you know.
But I do know everything.
But the correct word is thyroid, not thyroid.
Oh, thyroid, same thing, man. You knew what I was saying.
And Mimi Matthew was just checking that out.
His name is William. You don't even know your son's name.
Yes.
My God. You will need to check your memory too when you go.
So, Noreen, you mean for turn and tell me that all of those tests you could go and do at those expensive hospitals and labs?
Well, that's what the girl at the health center said. You could do it at private hospitals too, Marcus. Oh, wow. This is so nice. Look, Marcus, we should... Wait, what's this thing here? They got some dots and some squares and it says scan. William, what's this? I'm too old for this. What's that there?
Oh, look, Mom, it's a QR code. All you need to do, take your phone camera, scan it, and they can show you where you could use the vouchers.
Oh, wow, that's nice.
Oh, let me see
man.
that. Q who?
QR code.
Oh, Marcus, there's a lot of places on this list. Look, and that one is close to us, Marcus. You know what? Bright and early tomorrow morning, we're going to go.
Man, man. You forget we already have plans. And
Marcus, you see, this is the problem with you. You do not take your health seriously, Marcus. Look, the whole of last year, we had this child here suffering, Marcus, suffering because you wouldn't take him to the hospital or the health center because you don't like those places. You always play cheap. The child was suffering. Child couldn't even see on the blackboard. But you didn't even know that I used the Ministerial Health eye test and spectacles voucher to cut our costs, Marcus. You're so cheap. If it wasn't for me, the child would have been blind today. No, you had to leave my child to squint and see on the board, Marcus. He would have been blind today. But because of me, Marcus, he could see good. Well, partially the ministry too, but me mostly. He could see good. He could see how cheap his father is.
Man, Noreen, you see, you always try to embarrass me in front of my son, because I love him and I would do anything for him. Man, look what, tomorrow we're going to go and do those tests, man.
Good.
But if I want to do all of the tests, right? All of the tests without the back of the voucher, the 10,000 can't cover it?
Marcus, man, is so you cheap? Marcus, if the thing come up to a little more than the 10,000, you can't put the money, Marcus. Look, some of these tests is $2,000 and $3,000. How much more than 10,000 it gonna come up to?
All right, Noreen, all right, man. We gonna go. And since we going, you're gonna use that cervical cancer screening voucher and do your test.
Well, you don't have to tell me a second time. I intend that this year I'm going to be fit and proper.
Fit and proper, no? The body need work, but I tell you, the mouth get a lot of exercise.
Thank you.
Thank you to Matthew, William, and Maria. I hope I get the names correctly.
No, you didn't.
Thank you very much. Thank you very much. Nothing to laugh about. At this time, please make way for remarks from our Honorable Minister, Dr. Frank Anthony, Minister of Health.
Thank you very much, Mr. Gouveia. His Excellency, Dr. Mohammed Irfaan Ali, my colleagues in the Cabinet, Minister Robson Ben, Minister Colin Crowell, members of the diplomatic community here in Guyana, staff of the Ministry of Health, and all the different groups that are represented here today. And of course, I want to single out the providers of the laboratories who would be working with us on this program. I want to first of all start it out by thanking His Excellency for another very innovative program in the health sector. You know, one of the things that we have been looking at was how do we improve our hospital infrastructure, and we have done a lot of work on developing these things and trying to improve the quality of care. But a lot of what we have done is on the curative side. And what we want to make sure is that there's a continuum. So we want to focus on the preventative side, and that's where these vouchers are situated, to make sure that people can get the relevant tests, and once they're tested, we can determine whether they're at risk for certain diseases, and if they're at risk, what precautions they need to take. If they're already, because there are some people who would go around and they probably don't know that they're suffering from a particular disease because they haven't bothered to check, but they might be having symptoms. And with these types of tests that we're doing, we would be able to at least identify the more prevalent communicable, non-communicable diseases that we have in our country. We also took the opportunity in this initiative to make sure that we focus on our children. And this is also complementing a program that we introduced about a year and a half ago, where we have started a school health program, going into the schools, screening every child to ensure that they are healthy. And when we talk about screening every child, what we've been looking at is checking their eyes, as you heard from the skit, to make sure that children can see properly on the blackboard. We have also, nowadays we are moving away from blackboards. We have smart boards in our classrooms. And we also want to make sure that they hear properly. So we're doing hearing tests for them. We want to make sure that they have good dental hygiene. So we do check that and do a general checkup for them. So this is going to complement that. And when you look at the voucher, you would see that there are a lot of tests that are for school-age children. And when we do these screenings, we can identify whether they have any challenges. And if they do have any challenges, then the ministry, along with our partners, we are able to work with them to fix this. So there are lots of good things that are happening, and this voucher is one of those really great initiatives that would help with the prevention of diseases or to delay the onset of diseases. So this is, I think, extremely important for us. And once we get people to participate and work hard to cover those numbers across the country, in every region, then I think we are on a path of a healthier Guyana, which is what we are aiming to do. We, of course, we have been working with a number of partners. So while we have a plan of what we want to do in the Ministry of Health for the last couple of years and going into the next 5 years, we have mapped out a strategy of where we want to go. We also realize that we can do this with a lot of partnerships. Over the last couple of years, we have developed a number of partnerships with different countries, different academic universities, different hospitals. So, for example, we have a great partnership with Mount Sinai in the US, and they have been funded by the HES Corporation. Through that partnership, we have been able to leverage the expertise of Mount Sinai, their top leadership, all their top consultants, to come and work with us here in Guyana. And I'm sure that some of you who would have visited the Georgetown Hospital, you would have seen that there have been improvement in the hospital, the quality of care that we are able to offer. And that's because we have a leadership team from one of Mount Sinai's hospital working directly with the GPHC to make sure that we improve the quality of care, looking at waiting times and a whole host of other parameters so that we can improve the experiences of patients. That's just one component. We also have another component with them that looks at primary health care. We know that one of the challenges that we have in Guyana is diabetes. And so for diabetes, we have worked with Mount Sinai to develop diabetes guidelines, and we have been rolling that out and implementing it across the country. We also have a challenge with cardiovascular diseases, and we have seen if people don't take care of their health and they don't take the relevant precaution, that they can end up with heart disease and come into the facility. And so we have been working with Mount Sinai to develop a comprehensive program so that anybody with any heart problem at any point in this continuum, we can have interventions and help to treat them and prevent complications from happening. So that's another good program that we have with Mount Sinai. But I think as we work, one of the things that we have looked at is to ensure that we have healthier children in our classrooms. And we have started this school health program that I referenced earlier to make sure that every child is screened, and we are now tracking the data, monitoring that, and during their school life, they'll be screened at nursery, then primary, and then secondary. And if there's any changes, we'll be able to fix those things. And so this is another area that we have worked on. Most of you know, if you know Mount Sinai, you would know that they're also very strong in cancer care. And we have been working with them on cancer care, and we have set up about a year and a half ago, His Excellency commissioned one of the most advanced labs in the Caribbean, where we are able to do histochemistry and histopathology, so that if there are any cancerous growth from the samples that are sent to us, we'll be able to identify that. Just about a year ago, if somebody was diagnosed with breast cancer, it used to take, in the public sector, at least 3 months for us to be able to assess that sample. We have reduced that processing time to now between 3 to 7 days so that people can get their results. And all of this we have done in collaboration with our partners, Mount Sinai. And going forward, there are a number of areas that we have identified, including working on the development of an oncology center here in Guyana. While we have been working with Mount Sinai, there are other partners in the US that we have worked with. And another big partner that we've been working with is the Northwell Hospital chain. And they have been able to send persons to Guyana to work with our doctors here, and we have been able to send people for training at Northwell. We have had somebody who was trained recently at Northwell and came back and is now doing work in urogynecology, an area where we previously did not have any specialists. And this collaboration is going to continue, where we'll have a lot of persons coming down, working on site and training people right here in Guyana. We have a partnership with a group out of Maryland, and that group has done fantastic work for us, because previously we were not able to do things like implants, but now, because of that expertise, we are now able to replace knee joints, we are now able to do hip joints and so forth. Last year, for example, we were able to do at least 200 hips and knees, so that persons in this country can benefit from those interventions. And what is more important is that this partnership, Operation Walk Maryland, they have been able to train a lot of our doctors so that they too would be able to do it when the mission is not here. They are able to do this almost on a monthly basis, and our patients can now benefit. So we have built that capacity, so much so that there are now countries from the Caribbean who is asking whether they can send persons to Guyana to get training. So lots of good partnership with institutions in the United States, and we have benefited tremendously from these partnerships. We also have another good partnership with Harvard University. We have had a team that has been coming down here, working with us to eliminate disease, such as malaria. And one of the outcome of those visits is that we've been working on an app where this AI system that we are developing would be able to read malaria slides. So far, with the test applications that we have run in Region 9, it's about 99% accurate. And we're hoping that once we get in more test results, that what we have developed and pilot here in Guyana, that this now would be used in other parts of the world where there's malaria. So this application can be used to help other countries that are having a malaria problem. But it would have been worked on, tested, developed here with our partners at Harvard. While we look at the US, we also have very strong partnerships with Canada. And in Canada, we have been working with York University. We have trained a number of persons who are now working with us as hospital administrators. We have also trained a number of physicians who are now working on physician leadership. And so when they go to some of these facilities that we have built, they're able to now take on these leadership roles. And I think that is extremely important for us as we work to build our system to make it a world-class healthcare system. Apart from York University, we've also been doing a lot of work with McMaster's. And we have an MOU with McMaster's to send, over the next 2 to 3 years, at least 30 persons who would be able to get fellowship training at McMaster's. Already we have seen a number of persons went over there for training. We have vascular surgeons that were trained at McMaster's coming back here and working. Right now we have a neonatologist who is at McMaster's doing training. We have persons in cardiology and a whole host of areas where we don't have these specialists. We are now sending them to McMaster's for training, and they're going to come back and work with us. One of the good things that we have with McMaster's is that when our doctors go there, they're licensed to practice in Canada, and when they finish their training, that license is withdrawn and they come back home so that they can work at home. And I think that's a very good thing for us. In addition to what we've been doing with McMaster's, there's another institution called Mohawk, and this year we'll be training a lot of people to become ultrasound technicians. This is an area that we don't have a lot of people in, so we'll be training a lot of people to become ultrasound technicians. And this first batch is then going to train other persons here in Guyana. And there are other partnerships that we have in Canada. I'm just mentioning a few of them so that you get a flavor of what we have been doing. We also have strong partnerships with the UK. And right now, apart from the UK assisting us in developing or financing the maternal and child health hospital, we have been talking to the UK to extend training. They have trained a number of persons in public health at various universities in the UK, but very soon we'll be working with them on a in a very close manner, so that a number of their academic institutions would customize programs for us so that we can send our doctors, nurses, other professionals to be trained and come back to Guyana. So this is a very extensive program that we are developing with the UK. We also have a good partnership with the EU, and recently in Barbados, when the President went for the CARICOM Heads of Government meeting, a memorandum of understanding was signed between Guyana, Barbados, and the EU so that we can extend our collaboration. The EU is going to fund this partnership, and among the things that are in that partnership is to look at preparing Guyana to become a hub for manufacturing of pharmaceuticals and vaccines. We are looking at developing a stronger regulatory institution, and with that stronger regulatory institution, then when we certify something, then it would be accepted by other jurisdictions. And they have identified Lithuania as one of the countries that would offer us technical capacity building. So we'll be working very closely with them. In addition, some of the funding that they have set aside would allow us to have academic partnerships with various universities in the EU. And already we have visited and talked to some of these institutions in Germany, in Holland, in Belgium, in France. So all of these partnerships we are developing, and you would see a number of persons going off to get training and a number of their persons coming to Guyana where we can have these interchanges. Very soon, we would have in June an EU mission coming to Guyana to explore opportunities in health, not just in the academic training, but also other opportunities on how they can partner with the government in the area of health. We have also started a very robust partnership following Prime Minister Modi's visit to Guyana. We have extended now our partnership in terms of health with India, and one of the things that we'll be doing is developing a partnership with the Apollo hospital chain. And they would be coming to Guyana soon, and we will be signing a memorandum of understanding, which includes us being able to send our doctors to India so that they can get postgraduate training. And also, India would be sending to us here in Guyana experts that would be working locally with our team so that they can improve their capacity in certain areas of surgery and other areas that we currently do not have. Apart from that, there are a number of training platforms that they have in India, including a platform called Medversity, and again, we'll be doing a lot of training through them. So these partnerships are going to help us to grow. And when the President talks about developing a world-class healthcare system, we recognize that if we are going to move this system forward, if we are going to develop it to that level, then we need partners that have demonstrated excellence in healthcare across the world. And we have been seeking out the best partners to make sure that we can bring them in and work so that we can develop our skills. We envisage over the next 5 years that Guyana would be a hub, not just for clinical excellence, but we would also be a hub where people would come here and do manufacturing, whether it's pharmaceuticals, vaccines, or devices. And our legislation that we passed about 2 years ago allow us to do some of the most innovative types of research here in Guyana. So right now, one of the cutting-edge techniques is to use stem cells, and we are prepared, and we have been talking to a number of companies who want to come into Guyana and use those technologies here in Guyana. We have also, and I know the President has engaged a number of companies in the area of AI and the use of AI in its application in health, because we feel by doing that we will improve the efficiency, we will also be able to improve the quality of what we are delivering, and we can do that at a lower cost. And so you would see us start using, we have been using it in a very limited way, AI application to reach us X-rays. But you will see us start changing and using these systems, most of which would have already have FDA approval, that we'll start using these applications here in Guyana so that we can improve the quality of care that we are offering to our patients. And then very soon, we'll be signing on to start our electronic health records. And once that is done and we have that populated, then we'll be able to provide even more care for our patient, better quality of care. The intention is to use an app on your smartphone so that you can make appointments to go see your doctor. If you need to get your medical record, you'll be able to open that app and you'll see all your medical record there and things like that. So we are moving into the 21st century in terms of medicine, not just advancing care and looking at clinical excellence with our external partners, but also using technology to enable us to deliver quality care to our people. And this, when the President speaks about world-class health care, this is what he's talking about. And you don't have to wait long to experience it. You've already started experiencing these changes, and you will see many more things being rolled out in the coming years as we pivot to using these types of systems. But while we do all of that, we also want to make sure that we prevent diseases from happening. That is why this voucher and the use of it is so important. So please, let's make sure that we take maximum benefit by utilizing these vouchers across the country so that we can all stay healthier and enjoy the prosperity that our country is experiencing. Thank you very much.
Thank you very much, Minister of Health, Dr. Frank Anthony, for giving us a flavor of the wide range of initiatives that are in place and are being implemented as we develop across the country for continuity of care. Ladies and gentlemen, I want to make way for our feature address. I believe His Excellency don't need further introduction, but I want to make way for His Excellency, Dr. Mohammed Irfaan Ali.
Thank you very much. Please have your seats. Members of Cabinet, distinguished members of the diplomatic community, our healthcare professionals and workers, members of the joint services, our children, distinguished ladies and gentlemen, good morning. I'm very pleased to be a part of this very important launch as we seek to further enhance our health architecture and infrastructure here in Guyana. It is an amazing future that the children of this country will inherit. And we want to commit to the children of this country and to the people of this country that we are not only going to build a world-class healthcare system, but we're going to deliver world-class healthcare services to every citizen of this country. And today is another addition on that journey. France spoke extensively about the great partnership that the Ministry of Health has embarked on with some of the most significant global partners. And that did not come easily. That came through hard work, strong leadership, strategic foreign policy, and maximum and optimal utilization of time when we go to international forums and meetings. What was announced just now, this series of partnership, is a testimony to a results-oriented government, a results-oriented system that seek to calibrate the best available skills with what we have, so we'll have the best possible outcome. And I want to say that our health foreign policy has brought tremendous goodwill and results for our country, and we must applaud that. Very soon, we will launch a massive national program with one of our international partners and Men on Mission to have as many men within the age range in our country screened for prostate cancer, because early detection gives you a better chance of having the best result. And we're already working. Spent an entire day with a team at Northwell working on a strategy that will address prostate, breast, and colon cancers. And we're going to map an early detection strategic approach towards national screening and treatment. What Frank could have gone on to tell you is that not only are we building these partnerships, but we are investing in the equipment, in the technology, and in the tools for treatment. And because of the incentives we've given the private sector, we have seen massive investment from the private sector in healthcare, in improving their level of service and enhancing the environment in which they're delivering healthcare. And we are continuing to facilitate that investment so that our health ecosystem, public and private, can work seamlessly in delivering the best health care to our people. And this health care will not only be for Guyanese. Already, in CARICOM, many of our brothers and sisters are benefiting from our healthcare system. Our healthcare system is meant to support healthcare within the region, but importantly, to deliver global health services here in Guyana. And that is why international connectivity and connection and partnership is so critical. Because we see Guyana as an attractive destination for global healthcare services. And that is what we are building for, a global market here in Guyana. Let me also say that the vouchers that you see here and the prices on the vouchers, there's an added benefit. All of these prices would have in it inherently a 40 to 70% discount from what they were originally at the private labs and hospitals. So even once you have this voucher, it is not only about the $10,000. It's about a 40 to 70% discount on the services that you would receive at the labs and hospitals. And I want to applaud the private sector for their level of consciousness in supporting this initiative. There is another important addition, and that's in addition to the skit. There is another important addition I want to make on the minister's presentation. We are working with the best AI and robotics providers in the healthcare system. And we're going to identify a national panel of doctors that will be specialized and specifically trained in AI-guided surgical treatment, AI and robotics, so that we will have a panel of doctors supported by an external panel of doctors that will be supporting the healthcare system on 100% AI and robotics. That is already in negotiations. And that will come into operation early in the new year. Just as we get past just as we get past our democratic responsibility of electing the government of our choice. Today is also significant in many other ways. The key to great research is data. The key to great policies and programs reside in data. The best decision-making are those supported by data. The best crime-fighting strategy are those supported by data. And for sure, the best healthcare system must be supported by good, reliable, strong, efficient data. And we will be living in a country in the not too distant future where every child from birth will have access to their medical record until they make their exit from the earthly place. And every healthcare professional would have that data to support medical care for that child across every platform, integrated in every healthcare system. That is the future of the healthcare system that we're building. Inherently important with that is the level of responsibility it brings with it. Because there's an automatic assessment of the medical professionals and healthcare professionals on the level of service that they deliver. Holding people more accountable. Because we have to be more accountable with the investments that we are making. We want a system that relies heavily on independence. What do I mean? When we invest in the technology and the information system, it must remove, as far as possible, human biases. So it does not depend on the mood of someone you approach when you enter a hospital to decide whether you go in first or last. But there are AI systems now, and we have started to use that will take the symptoms of persons from the time a medical professional received the call and will do an AI assessment as to the level of urgency. And that assessment will tell you, based on the symptoms, triaging through AI, whether that person is critical or not. Now, it's all human-based. And that is a system that we are going to introduce very shortly. Automated Materials Management Unit for medical supplies across every medical institution. That is the future we're embracing. You know, in January when I announced that before the end of the month, travelers must be able to use the electronic immigration form. The critics, the extraordinary critics in our society, were quick to dismiss it as a joke. I am pleased to say that within the schedule, we have implemented the electronic immigration system, and persons are passing through the airport. We don't create a system to be perfect on first roll. Any system goes through a testing phase. And before the end of this year, the Ministry of Health knows, the Minister knows, that he has a mandate to ensure the entire MMU is automated, digitized, and AI assisted. So, currently, we are also working on the upskilling of our nurses. We have an offer from India to have large batches of our nurses specialized. I see many of our diplomatic friends are here. Sometimes they get excited when they hear this, because they get a recruitment ground. But specialize in service to Guyana. So I want our friends to help us to ensure that our nurses that we're investing heavily in, our nurses that we're going to spend a lot of resources on, to specialize, will deliver to our healthcare system the best possible service after specialization. So you too have an opportunity to demonstrate your ability and your professionalism to be part of this elite group of nurses that would get the first chances of specialization. And your salaries and your benefits are going to get better and get better quickly. And when I say that, you know I say that, and you can trust me and trust this government on that, because we have delivered to you above and beyond whatever we promise. Because I believe strongly, and fundamentally this government believes strongly, that when we say we are going to do something, the population must trust that we're going to do it. And you've seen us. You have seen us deliver. You have seen us work for you. Living a life of gratitude is a difficult thing. As a people, being grateful for our own blessings, being grateful for the ability to smile, being grateful for the ability to be trained to become a nurse free of cost and get a stipend while you do that. There are many people in the world who would love that. Don't take it for granted. Don't take it for granted. Don't ever believe that these things are accidental. These are investments that your country is making in you. These are investments that the generation of tomorrow is sacrificing today for you so that you can leave behind a system that will take care of them. Do not betray that responsibility. We are grateful and thankful. I visited the maternity wing of the Georgetown Hospital, and the nurses there were brilliant. The doctors were brilliant. They were joyful. They were grateful. And they occupy a special place in my heart. By your very attitude, you can create your own space in every environment, and you can never tell the effect of that space you create. In life, you have a choice to be pleasant or to be obnoxious. Whatever choice you make will impact the response. That's my own philosophy of life. People ask me, why are you always so joyful? Because a good book tells you how to make a joyful noise. And what are the returns you can get from making a joyful noise? Make no mistake, your future is much more brighter than those who you replace and those who went before you. Make no mistake, your condition of work is much better than those you replace or those who are before you. Some of them, many of them are still around. You should ask them. You should listen to the stories. You should listen to the stories, and maybe we will have a better appreciation for where we are today. Just maybe. And so too, your stories of sacrifice will be the legend of the stories of those that will come after you. And those that will come after you will reflect and say, yes, my predecessors did sacrifice, and I inherited and stand on the shoulders of their sacrifice. A healthcare system is dead without healthcare professionals. A healthcare system is dead without healthcare professionals. I've seen across this country, in the distant villages of the hinterland, dedication, hard work, commitment, and love of healthcare providers, and I applaud it. I've seen the endless sacrifices of medics, paddling a canoe to take care of patients. I've seen medics walking in the forest for hours to attend to someone injured. And I've heard the story of my legendary father paddling a boat in the Essequibo River as the only teacher in the school in Hog Island to encourage children and pick children up from their homes to take them to school. And I've lived to see managers of banks, doctors in distant countries call him out from the back of the line to give him service at the front of the line. You can never tell what will be the impact of your service. You can never tell what will be the lasting story of your service. So make that service count every day. Today we live in a world where 80% of chronic diseases could be prevented. Just think about this. 80% of chronic diseases could be prevented by better lifestyle, by better choices. But we can't understand what those choices are if we don't have the data. We may very well find in this process that persons in a particular village or region are less susceptible to diabetes. And then we want to examine what do they eat, what lifestyle they live, so that in our own local environment we can replicate that. 80% of our suffering can be reduced just by choices and lifestyle. 63% of deaths are linked to chronic diseases caused by unhealthy behavior and bad life choices. I always tell people, don't follow me and drink all those Diet Cokes as you see I think. 63% of deaths are linked to chronic diseases caused by unhealthy behavior, bad life choices. Drinking and driving is a bad life choice. Smoking is a bad life choice. The Attorney General has confessed of one such bad choice that he gave up. The healthcare industry is shifting from a treatment-based approach to preventative healthcare. Major shift globally from a treatment-based to preventative-based healthcare system, focusing on early detection, vaccination program, lifestyle changes, and policy intervention. And that is what this allows us to do. We can't do any of that if we don't have the data, if we don't have the basis. And in all of these areas, detection, vaccination, lifestyle changes, education, and policy intervention, we are buttressing our healthcare system. Then the third area is spending on prevention. Global spending on preventative medicine remains low compared to treatment-focused healthcare. In the US, for instance, less than 3% of the $3.6 trillion healthcare budget is allocated to public health and prevention. Less than 3% of the $3.6 trillion healthcare budget is allocated to public health and prevention. That is to tell you that even in the most sophisticated economy, the most sophisticated system, this issue is one that is challenging and one that is being addressed from a budgetary and policy basis. Communicable disease, economic disparities, and environmental factors impact preventative health efforts. Climate change, pandemics, and lack of access to quality health care are major barriers to global preventive medicine. Governments and healthcare organizations are increasing investment in public health initiatives, driven by digital health technologies, AI-driven diagnostics, and vaccination programs. These are the three key drivers. Only recently, at the heads of government meeting, we saw from one of the Silicon Valley companies, a startup, a new technology now that will do all imaging, MRI imaging, without any radiation. So the risk of radiation is removed. They will have full MRI imaging, CT scans. But guess what? With radiation, you can only do it maybe once every year or every 3 years. With this technology and removing radiation, you can do it as much as you want, examining the problem. And that is already on us. So whilst many countries will be investing in equipment with this high radiation, the world is already moving forward. And these are the same people who invented digital X-ray. So the level of success for this innovation is kind of high, because they're the ones who brought digital X-ray into play. With a cell phone, and Frank would tell you because I sent him to see it. A cell phone, they can do all the ultrasound, and with data, transmit that ultrasound directly into a medical center or a hospital. And guess what? We have already procured, or in the process of procuring, that to help our hinterland health workers, medics, and doctors. Yes, not only ultrasounds for pregnant mothers and other persons, but ECGs. So you can do an ECG and send it digitally. And that is part of our telemedicine program. And the telemedicine program, let me say this to the private hospitals. I've asked Dr. Anthony and the AG to come up with a legislative framework and a policy framework through which we will develop a national telemedicine hub that every hospital must be connected to. The private and public hospitals, the health centers. And that telemedicine hub will then be connected to global telemedicine hub that we're going to pay to be a part of. So 24/7, we will have specialists in a global and national telemedicine hub supporting medical practitioners in their hospitals, health centers, and health facilities across the country. I am not a medical doctor, but I can speak to you for hours on what we are doing in this in delivering world-class medical services, just like we're going to do for education, because we are serious about this. We are very, very serious about this. So the government and healthcare organizations are increasing investment in public health initiatives. Now let us look closer to home. Non-communicable diseases, NCDs. here in the Caribbean. NCDs account for approximately 76% of deaths in the region. 76% of the deaths in this region. The top NCDs include cardiovascular diseases, cancer, diabetes. These are some of the top contributors. And when you look here at home with Northwell and Mount Sinai, we just completed some review. And you will see prostate cancer that we can really reduce deaths in, because early detection is the key. And breast cancer, early detection key. Cervical cancer, that these are the three top ones here in Guyana. And all three of them, we can reduce death in an extraordinary way with data, early detection, and early treatment. Breast cancer can be rapid, depending on the stage. That is why reducing that time from 3 months to 3 to 7 days to the ordinary person may seem irrelevant, but that by itself can save thousands of lives. Make no mistake about these investments. But also in this region, creeping up on us are issues of mental health. And we have to address this. Mental health challenges. And that is why we are working now on the creation of a 24/7 mental health platform to support persons. I've asked Frank to look at an international institution that we can link the platform to with professional counselors, so that we can have those professional counselors available here to support our local platform, whilst we build and train the capacity that is needed. The World Bank estimates that the economic impact of NCDs in the Caribbean could reduce GDP if not properly addressed. And some of the high-risk factors in the region include the prevalence of obesity, physical inactivity. Imagine we live in such a beautiful region where we can walk. And this is how public policy must change in the region if we are to address these issues. Riding and walking to work, creating a safe walking ring in the city of Georgetown, where you can walk between offices, walk to central location. So when people seeing us with the King's Foundation, creating this walking ring, creating the cycling ring, it is about a policy that is driven by a greater objective. Physical inactivity, creating all of these parks. Even if we have to put free Wi-Fi in the parks, to get the children out of their homes into an environment in which they can do physical activity and still know they can be on their device. Our children have access to what we don't have access to, but we are allowing that access to destroy them, because they're sitting in their homes. And as time progresses, they'll be sitting in their AC rooms with a device, eating drinking the sugar, and not going out and have physical activity. That is why I've asked the Ministry of Education to place great emphasis on physical education in the school system itself. We have to rebuild physical education and sports in our school system to get our children away from those devices, reduce the time spent on devices. Otherwise, we are going to be contributing to a massive problem in the future. Not only that, many of our children today, Frank will tell you, based on the tests that we are doing and the data we have collected on the healthcare, eye care program, many of them need spectacles at a very young age now. And when you examine the data, you will see those that spend massive amount of time on those devices, that they are being impacted. More than 60,000 tests we have completed. 68,000, almost 70,000. So these programs, you know, for the critics, they will say another voucher. They don't understand the impact of this. They don't understand the far-reaching aspect of this in policy making and improving national life and national welfare. Without intervention, NCDs are expected to rise by 15% over the next decade in our region. By 15%. And this, of course, will bring tremendous strain on our healthcare system itself. Here in Guyana, to support our investment in preventive medicine, we're also investing in a new maternal and pediatric specialty hospital and 6 regional hospitals. We have spent directly in support of children, men and women health care, where they needed specialized care, where they needed specialized intervention, where they needed specialized support. We have spent almost $4 billion in supporting our citizens. Supporting through counseling and guidance the more than 1,100 pregnant adolescents in our system. Supporting hundreds of children with type 1 diabetes. The school initiative we launched with Mount Sinai, an investment of close to $300 million, benefiting more than 17,000 nursery school children who we now have data for. Almost 20,000 primary school children. Hundreds of millions of dollars allocated to the breast milk substitute program, benefiting almost 1,000 exposed infants. Those are initiatives you don't hear about every day. Those are initiatives more than 75% of countries are aspiring to. More than 75% of countries are aspiring to these initiatives. We have them. I always ask the question, is the glass half full or half empty? You be the judge. 50,000 children, more than 50,000 children receive eye screening. Children alone. Almost 37,000 children receive spectacles. hundreds of millions of dollars spent on the purchase of sanitary pads for women and girls, putting them back in school. Many of them would lose days, learning days every month because they did not have access. First Lady launched an initiative, and that initiative has brought global acclaim. Is the glass half full or half empty? Almost 10,000 women benefiting from the cervical cancer screening. 25,000 men benefiting from the PSA testing. 13,000 various testing. 13,000 had their PSAs done. Almost 1,000 had biopsies of the prostate. All of that free of cost. And in the last year since we have launched this program. The cynics and critics would never speak about these things. Hundreds of millions of dollars spent on screening equipment. 62,000 persons. 62,000 beneficiaries benefiting from the investment in contraceptives. $108 million on the HPV voucher program. 22,824 females benefiting from the HPV vaccination. I'm not speaking about the many other services that we have delivered that include hip replacement, dialysis, cardiac medical treatment, prosthetic, imaging, all of these other support services. And guess what? We have done all of this almost completely with the same bureaucracy in the healthcare system. They took on the load. They took this challenge. They're not celebrated every day. The same specialists, the same bureaucracy took this load and brought this level of success. Are there challenges? Of course. Are there cracks in the system? Of course. But I can say without a shadow of a doubt that the cloud of hope and the hands of success far overshadow those cracks. And I want to salute our healthcare workers. You don't hear every day about the more than $500 million we spent on cold chain service that ensure we have vaccines available in the regions and different areas, the solar refrigerators, the walk-in storage units. You don't hear about those things. The maternal and child care boats, the ANC and neonatal equipment. There was a time when in Latam, for specialized care, everybody went to Brazil or had to come to Georgetown. We've reduced that to less than 2% now. And you want to hear the story a bit further? The traffic coming from Brazil has increased by what now? How much? 400 plus surgeries. To 400 plus surgeries coming from Brazil. That is because of the trust and confidence in our system. And I always highlight Region 9. Region 9, don't ever disappoint me. Region 9 will be a global study for first-class healthcare system. I encourage everybody, media, everybody, go and see what those guys are doing in Region 9. Go and look at the results. Go and look at the changes. Extraordinary. When I look at the numbers, I invited them for lunch. Remarkable work there. And in all the other regions too. But I believe that they would inherit the fruits of their labor. The more than 28 ultrasound machines that we have added to the system, the incubators that we have added to the system, all of this is as a result of strong policies, great investment, and of course, a government that is committed to the people of this country. We are not a government that is seasonal. Let me be very clear. We are not a seasonal government. We don't take an opportunistic approach to national policy and development. You don't hear about these developments every day because we are not on a showboat. We are busy every single day working. When I leave you here, we go with the technical people to work on fixing roads, fixing health centers, fixing community grounds, because we have set minimum standards for all of these facilities. Last week we launched in here the newborn voucher, and our beautiful babies came to celebrate with us. We didn't invite the babies came. And some of the perpetual critics in our society did not take time to acknowledge our health workers who created breastfeeding stations, medical health support stations, medical education stations, care packages for each of those babies that came. They did not say thank you. They didn't know half of the support that was given. But all they could have seen was an opportunity to criticize. And I congratulate them, because it's add to the fact of the beauty of a free and democratic society. That is the society we uphold. That is the society we honor. And that is the society I'm honored to lead. A free and democratic society that must only be led by your conscience. One day, your conscience will return to you and be the judge of the time you spent here on earth. I thank you and God bless you.
Thank you. Thank you very much. His Excellency, thank you so much for pointing out the wide range of strategic partnership that is set within the health outfit of the landscape to benefit our nation, and also to rightfully pointing out the enormous effort that is made by our healthcare workers and applauding that, and also to remind every healthcare worker and partner of our responsibility to value the efforts that are being made. And so I want to say thank you, Mr. President, for those very encouraging words. At this time, we would like to invite...
Yes, Mr. President. I just want to add one thing that I forgot. We have almost every accredited lab or medical facility will be providing this service, more than 49 across the country. So they can go to more than 49. All that are accredited are on this program. And for those in the hinterland, there will be specific programs work out for the samples to be taken so they can be supported while we grow the capacity in some of these areas.
Thank you very much, Mr. President. And that is exciting news. And we will continue to push this health agenda to all our people across the country. At this time, I'd like to invite some of the students and some healthcare workers to participate in this ceremonial handing over a receiving of vouchers from His Excellency. And to assist us with calling those participants, I would like you to welcome Ms. Claire Clark to help us in the process.
Good morning, everyone. So I'm going to be calling the name of the students first. So when you hear your name, could you please stand and move to this area? Akila? Akila? Michaela Griffith? Danish Knott? Priyana Prasad? Jason Dialal? Shivani Chandradat? Avi Chandradat? Vijay Chandradat? Jaden Diolal? Tanaya Gobin? Maria Diolal? Afraz Khan? Chris Visnoth, Krish Bishan, and Suraj Bishan. Zayn Demert, Linish Manga, Simran Prasad, Ashanti Mohabir, and Justin Prasad. Adults, that's it. 3 adults and then the rest is Do I call them that? Okay, I'd like to ask Mr. Mohan Narayan, Ms. Purnamati Parasram, and Ms. Basanti Hari Prasad to come forward. Okay. Joyanne Sampson, Naomi Johnson, Keshi Perks, Everett Ross, Deborah Skeet Charles, Ashley Harris, Candessa McLennan, Juanita Narain, Nalini Singh, Lisa Moore, Samantha Prasad, Molly Ann LaRose, and Melinda Haramutu.
Put your hands together for the men on mission. We have a few more distribution to do for some secondary school children. And then we'll ask the regional health officers to come and pick up your package for your regions. You can do that right now. Yes, and His Excellency will make the presentation to you. In any order. Doesn't matter, in any order. I will ask the regional health officers to kindly arrange yourself in chronological order. Exactly. I also would like to announce that we have providers who are prepared and ready just on the outside to commence the testing process. So if you have collected your voucher and you would like to be tested, you can do that right here at the Cultural Center. In the meantime, I'll ask the representatives of the laboratory, our partners that are going to be working with us, to please get ready for a photo op with His Excellency. Thank you very much, RHOs. We have a few more nurses. May I invite the members of the laboratory to come and let's have a photo op with His Excellency. Laboratories, hospitals, service providers, including iCare, HPV, and the Universal Voucher. Thank you.
Just look at this. Put your hands together.
Motivational check.
Motivational check.
The Lord, the Lord.
Motivational check.
All right. I got it. All right, thank you very much, everyone. And for those of you who are in the room, you can remain in the room to receive your voucher before you leave. And we want to say thank you very much on behalf of His Excellency and on behalf of the Minister of Health. Thank you so much for attending this very important ceremony today. God bless you. Bless you, yes. All right, just quickly announcement. So there's refreshment, light refreshment on the foyer on the western side on the upper flat of the hall as you exit. You can partake of some light refreshments in there. Thank you very much.
John, Wendy, lose all of them. Miss, come down quick, miss. Miss, please come quick. Sorry. Don't watch my dog. Go to the